the changes to the risk-adjusted strategy of government on COVID-19. Minister Dlamini Zuma will now brief us on the major aspects of the overview. Will give us the overview of the regulations, and then the details as gazetted in the regulations. The minister will be coming and fleshing out those details for us. How this briefing will run is that we will ask the minister to come up and give us that overview of the regulations, and then we'll allow some question time. Thank you very much. And with that, Minister, please come and brief us.
Can you hear me with a mask, or should I take it off?
We can hear you.
Hello. It's for the interpreter.
Thank you very much, colleagues, members of the media, and compatriots. Thank you for taking the time for us to elaborate and announce on the announcements that the President has made over the weekend. We've gazetted the regulations. Indeed, as the President said, I quote, "It has been an immense, difficult 5 months, and the pandemic has taken a heavy toll on the health of our people, our families, our communities, on the public health system, on the economy, and on people's everyday life." The pandemic has called on all of us to make individual and collective sacrifices. It is only through united action and the pursuit of a common goal that we can overcome the pandemic. Consequently, we may still be called upon to make further sacrifices and act jointly towards a common goal of defeating the pandemic. You will also recall that COVID-19 arrived on our shores when our economy wasn't doing well. There was high unemployment, rampant poverty, high inequality and hunger. The vast majority of our citizens continue to have shortages of basic services like water, sanitation, roads, and adequate housing. Our health and education systems were also not adequately equipped to deal with the challenges presented by COVID-19. Consequently, we had to mount a response that could adequately respond to the health and social and economic challenges presented by the pandemic. In recognition of our realities, we adopted the risk-adjusted strategy on the 21st of April. This allowed us to gradually open up the economy despite the increasing infection numbers as we walked the tightrope of balancing saving lives and livelihoods. Regrettably, over 11,000 of our people have lost their lives to the virus. We take this opportunity to re-extend our condolences to their families, friends, and colleagues, and community members. We also know that some of the health workers and frontline workers have also lost their lives. But we'd like to again salute the health workers and all frontline workers who are at the forefront of this fight. Ladies and gentlemen, after a rapid rise in infection over the months of June and July, the daily increases in infection recently appears to be stabilizing. There is a noticeable decrease, particularly in the larger provinces, the Western Cape, Gauteng, Eastern Cape. However, KwaZulu-Natal still provides some challenges, but we hope it will decline soon as well. Over and above the improved national case recovery rate and more than 80% of infected people are recovering, the fatality rate is also less than 2%. This suggests that the prevention measures that South Africa and all South Africans have implemented have been effective. This was confirmed by the Minister of Health, who informs us that there is now sufficient hospital capacity, including ICU space and ventilators. Consequently, we have called for a temporary suspension on the building of field hospitals and will be redirecting to maintenance and repairing existing facilities. As we continue with our fight against this COVID-19 virus, we aim to limit hardships, and there is no desire to leave stringent prohibitions in place when they are no longer necessary. It is for this reason that we've lifted the restrictions on a number of areas, but have maintained the curfew between 10 p.m. and 4 a.m. Interprovincial travel is now permitted. Basically, what it means, traveling around South Africa is permitted. The sale of alcohol at off-sale and retail outlets is permitted, albeit with restrictions. Off-sale only between Monday and Thursday from 9 to 5. Alcohol will be served also at places like restaurants, bars, taverns, where they are licensed. These establishments can operate, but only with a maximum of 50 patrons, so long as the health and hygiene protocols are observed. These include washing of hands, sanitizing, wearing of masks, and also 1.5 meters distance. Of course, whilst people are eating and drinking, they take off masks, but in between they have. We have also opened up gyms and fitness centers, and they are also permitted to conduct business with a maximum of 50 people and subject to strict health and hygiene protocols. So fitness and gyms are allowed to have 50 people at a time. So during the day, they'll probably have lots of people, but at any one time, they should only have 50. Restrictions on beaches and parks have been lifted, but also subject to prevention protocols and directions to be issued. The resumption of water-based activities and certain categories of tourism activities, including boat-based whale watching, scuba diving, shark cage diving, kayaking, river rafting, speedboat rides, are also open, subject to health protocols. Certain environmental sector activities are opened, including zoos, aquaria, animal sanctuaries, and rehabilitation centers, subject to strict health and hygiene protocols, including sanitation, wearing of masks, maintenance of social distance. To further mitigate the risk, the Department of Health is working with the relevant departments and sectors to develop guidelines. Hospitality and entertainment business, such as accommodation establishment, tour operators, and casinos, operate at 50% of floor capacity. Theaters and cinemas are now permitted to operate at a maximum of 50 persons at a time. subject to health and hygiene protocols, such as mask wearing, social distancing, sanitizing, washing of hands. Social events at places of residence are now permitted. These include visits to friends and family, so long as there are no more than 10 visitors at a time, and the health protocols of wearing masks, sanitization, washing of hands, and safe social distancing are observed. I think this is very important to emphasize because people, when they visit, they'll be probably visiting people who are over 60, some of them, who have comorbidities. So nobody would like to visit and find that, because younger people, sometimes they carry the virus without knowing they are positive. And you don't want them to come home or to visit a grandmother, aunt, uncle, or whatever, not knowing that they are positive, and then infect the older people. And we know that the older people are at risk. Their mortality rate is high. So it's important that when you visit, you still stick to the protocols. You still wear your mask, sanitize, and keep your distance, so that your visit should not lead to grief. So it's very important. Social gatherings such as funerals and weddings are now permitted as long as there are no more than 50 people gathered. But also, the health protocols must be observed. The night vigils are still not permitted. Funerals are still limited to 50 people wearing masks, washing of hands, and social distancing. It is our hope that in undertaking these activities, we'll maintain the strict protocols of social distancing, wearing of masks, sanitization, and washing of hands. We must exercise more caution and be more vigilant than before. It is our actions that will determine our future. When we further open the economy, it doesn't mean that the risks are lower. All it means is that we're trying to balance livelihoods, opening the economy, but the risk of the virus is still there. And the virus does not move, people move the virus. So the more people move around, the more the chances of the virus being taken from one person to the other. So that is why it is so important that as we open up pretty much everything, we must ensure that we keep to the health protocols, sanitize, wear masks, and keep a social distance. Because if we don't, we will see a next wave of infections, maybe even a bigger surge, which we would like as South Africa to avoid. We're in it for a long haul. It's not going to finish tomorrow. Therefore, we must remain vigilant and not get tired of masks, sanitizers, and social distancing. And for us to be able to fight successfully this virus, we must think of President Mbeki's words when he said, I quote, "Those who complete the course will do so only because they do not, as fatigue sets in, convince themselves that the road ahead is still too long, the inclines too steep, the loneliness impossible to bear, and the price itself of doubtful value." Because if we think, oh, now I'm tired, and then you get lax about the health protocols, you can infect other people and you can get infected yourself. So we shouldn't tire. We must just take it as a way of life now. I'm sure we saw some time back, Chinese, even before COVID, they were always wearing masks. It was like a way of life. Initially, I think they were wearing it for pollution, but now it's for the virus. We must also just get used to it. It must be cool to wear a mask. We must therefore protect each other because we are not safe until we are all safe. As we undertake social visits, let's keep our mask on, let's wash our hands, maintain social distance. And then, masesiphuzile, sibuyele emakhaya, when we have been drinking and we are now going back home, let's not get behind the wheel. If you are drunk, don't drive. Don't drink and drive. Let us drink responsibly and protect all our people, especially women and children. Let's not abuse women and children and pick fights. We would not like to return to a higher level of restrictions, so we must all act responsible. We must smoke cigarettes as they are now allowed, but don't share them because you can pass the virus to the next person. Given the high levels of risk associated with international travel, we'll continue with such restrictions. So international travel is still not opened. Having seen how young people have carried the virus to the elderly from nightclubs, we will continue with our nightclubs closed. And we've learned from other countries who opened up nightclubs, they had to close them pretty fast because the virus was just moving as fast and as energetic as the people at the nightclub. So to limit the risk, we have also implemented restrictions of spectators at sporting events. No spectators are allowed. Cruise ships for leisure are also not allowed. We also alluded to the fact that all our efforts are directed at the delicate balance of saving lives and livelihoods, to which end we must say the strategy was a dynamic roadmap that would strive to maintain relevance and advance our fight to protect people, but at the same time secure livelihoods. We wish to thank all South Africans, individuals, traditional leaders, NGOs, workers, women's organizations, business people, youth organizations, and every single South African for their contribution to the fight against COVID. But the fight is not over. Please continue. Even though we have eased restrictions, the risk is also increasing, for it is people who move the virus. We must, with vigilance, defeat the virus together. We must soldier on, work together. Indeed, it's all in all our hands. And it's not done until it's done. We still don't have a vaccine. We still don't have a cure. So let's continue. I thank you. Ngibonge nje kakhulu kunina nonke nakubantu bemedia bamaphepha intatheli nakunina nonke bantu base South Africa ngokuthi nithathe leli thuba ukuthi sizolalelana ngesikhathi sichaza ukuthi ke lezi zinto esho president ngempela sonto sezifakiwe zaba umthetho zagazetho. Njengoba umongameli asho ukuthi bekuyisikhathi nezinyanga ezinhlanu ezinzima ngoba lesifo leligciwane lokhuvethe le-COVID-19 luthathe abantu abaningi futhi lube nengcindezi kwezempilo nakubasebenzi abasebenza kwezempilo nakubasebenzi abasebenza ukuvikela nabo bonke abantu okuyibona abasiholayo kulempi. Lube ingcindezi futhi emindenini nasemphakathini nakwezempilo nje zizonke. Laba ingcindezi futhi nakwezomnotho. Kanye nje nokuthi lishintshe impilo zethu njengendlela esazi ngayo impilo usuku nosuku. Kodwa ke ukuze siphumelele ukulwa nale gciwane kufanele ukuthi sihlangane sibe munye sisebenzele into eyodwa yokunqoba leli gciwane. Kufuneka ukuthi kube khona ekade sikuthanda ekade kusijabulisa kwesinye isikhathi singabe sisakwazi ukukwenza ngoba sizama ukuthi silwe naleli gciwane. Uma sikwazi ukwenza njalo sisebenza sonke ndawonye njengesizwe njengabantu basemzansi siyokwazi ukusinqoba. Kodwa ke sikhumbule futhi ukuthi lesifo sifike ngesikhathi isimo somnotho la emzansi singahambi kahle. Kukhona nobumpofu nabathu bemsebenzi entuleka. Nje kukhona nabantu abangenako ukudla kahle. Futhi nezinsiza ezinye zingekho njengamanzi bekhona imiphakathi engenayo amanzi engenazo indawo zokuya endle bengenayo imigaqo abanye bengenazo nezindlu kanti nezempilo zethu sifike lesifo zingekho ezingeni lokuthi singalwa nalesifo siphumelele. Nezemfundo sibonile bekukhona inselelo ezithize ebezikhona ikakhulu ngamanzi but ikakhulu ngamaklasi aqinene ingane eziqinene. Lokho ke kwenza ukuthi uhulumeni azame ukuthi enze i-lockdown kokuqala ayenze ngendlela yokuthi singabhebhetheki kakhulu lesifo ngesikhathi sisazama ukulungisa lezi zinto bekufanele zilunge especially ikakhulu kwezempilo kodwa naka education nakwezinye izinto. Noma seyiphuma i-lockdown senza le strategy esithi ke sibheka ubungozi bese sehla kancane singaveli sivule nje. Ngoba ukuba savele savula nje cabangani ukuthi ngabe sikuphi ngamanani abantu asebesitholile lesifo namanani abantu asebesishiyile. Ngabe impela kubi kakhulu. Kubhlungu ke ukuthi noma kunjalo baningi abantu abashiyile abangaphezulu kweinkulungwane eziyishumi. Sithi ke emndenini yabo nasebanganini nakubantu abasebenza nabo akwehlanga lungehlanga. Sifuna futhi ukuthi abantu bezempilo nabo bonke laba abasebenza abahamba phambili kulesifo noma amasosha noma amaphoyisa noma abasemajele noma wobani abahamba phambili. Sithi kubona sinethulela isiqhoko kokwenza kahle umsebenzi wenu. Siyazi kunzima empeleni abanye benu baze bathola leligciwane abanye baze basishiya. Sithi ke kulabo abasishiyile imphefumulo yabo iphumule ngoxolo kodwa kinina sithi siyabonga qhubekani nenze lokho benikwenza. Konke ke lemizamo yenze ukuthi kuze kufike kule thuba esikulona namhlanje lapho sesikwazi ukuthi sithi awu noko kwezempilo sekuyaxeka ezibhedlela kusaqinene imbhede seyikhona iICU kumbi laba senqayini livulekile manje nemshini le yokuphefumula isivulekile isikhona engasebenzi elindile nje lokho kwenziwe imizamo yethu sonke kwenziwe ukuthi sikwazile sonke ukuthi sacrifice into eziningi esizithandayo indlela yempilo ebesijwayele sesifike ke lapho sesithi noko sekungozi makhaza okusho ukuthi sesingavula kakhudlwana manje ngoba masibheka iphondo lase Eastern Cape selingcono amanani abantu abathola lesifo sesiyehla nasentshona koloni naso siyehla nala eGauteng siyabona siyehla akusho ukuthi abekho kodwa inamba zisafani ngoba niyakhumbula kwake kwakhona isikhathi impela la kwakuba 12,000 13,000 inkulungwane eziyishumi nambili ngelanga manje noko sekungcono eKZN nakhona kusafani kodwa ke khona sisenalo uvadlwana kodwa siyethemba ukuthi nakhona kuzokwehla nabantu asebengcono akade benaso lesifo sebebaningi abayishagalombili eshumini hayi bayasimama nabashonayo amaphesenti angaphansi kwamabili abashonayo so ke siyabonga ukuthi sonke sibambe iqhaza lapho kade sikhona kwaze kwafika lapho sesikhona manje ungqongqoshe wezempilo njengoba esememezela ukuthi hayi sekungcono okusho ukuthi ke nokwakhiwa kwezibhedlela lezi ebezakhiwa nje ukuthi sibe zesikhashana sekuzoke kuthi ukuma ngoba kukhona ezinye ezikhona ezinembhede engagcwele yiko ke sesifike la sesithi kuzovulwa manje ukuthi kuvulwe izinto eziningi sithemba ukuthi masivula akuzuphinde futhi sibone lamanani sekhuphuka futhi ngesivinini kodwa lokho ngeke kwenzeke uma sonke sikhumbula ukuthi njengoba kuvulwa akusho ukuthi lesifo asekho noma sekukhona ikhambi noma sekukhona ivaccine cha sisekhona futhi sisahanjiswa abantu asikakwazi ukuzihambela njengoba ke kuvulwa kusho ukuthi abantu bazohamba kakhulu sonke sizohamba kakhulu sivakashe senzeni kodwa sihamba naso yithe thatha lesifo sisuse la sisibeke la sisithathe la sisibeke lapha kusho ukuthi ke ngempela imigomo le yaka health kwezempilo yokuthi kufanele sihlale sigeze izandla njalo noma sisanitize ngale mithi yakhona eno alcohol 70% sifake izifonyo kusabaleke kakhulu siqaqanye singahlali ngokusondelana sekubaleke kakhulu ukudlula ngoba manje sesihamba kakhulu okusho ukuthi ke manje ukuhamba nje la eSouth Africa sekuvumelekile sungasuka kwenye province uye kwenye sekuvumelekile kodwa imithetho ayixegisiwe nesifo asimile kusho ukuthi ke asihambeni kodwa sithi sihamba sibe sifaka ama-mask, sibe sigeza izandla, sibe siqaqana. Kodwa-ke kusashiwo ukuthi kusukela ngo-10 ebusuku kuze koshaya ihora lesine ekuseni kufuneka ube sekhaya. Ngaphandle mawusemsebenzini une-permit ke amaphoyisa ayoyibona leyo permit mayeyibuza. Yiko ke sesithi ngoba sekungcono naseyibhedlela sekungcono nogwayi usuyavulwa sekungabhenywa. Kodwa ke sisasho ukuthi msana ukubhemisana ngoba lokho kusangayenza ukuthi kuthatha ivirus igciwane lisuke komunye liye komunye. So notshwala sebiyavunyelwa, kodwa ke bona busenayo izinto imbandele khona yokuthi lapho thengiswa khona ukuthenga uhamba ekhaya kufuneka ungabuthenga kusukela ngoMsombuluko kuya ngoLwesine. Ngempela sonto abudayiswa ngoba impela sonto ilapha abantu bebuthenga khona kakhulu, bephuza khona kakhulu. La kuhlalwa khona laba abanama license bona bangavula ke ebuphuzwe, kodwa nakhona abuzuphuzwa ubusuku bonke. Ayikho nje indawo ezobe ivulile ngesikhathi se-curfew. Ngesikhathi se-curfew yonke indawo kufuneka ibivalile. Futhi akufanele kube khona indawo la khona abantu abangaphezulu kwama-50. Uma indawo ivuma ukuthi niba ama-50 niqaqene, kodwa imincane ingavumi kufuneka kube isibalo esincane. 50 ilapho ungadluli khona, kodwa akusho ukuthi sungacinanisa abantu ngoba nje uthi ufuna baba 50. Cha, kufuneka still bahlale ngokuqaqana, iqanti nohafu, iqanti nohafu. Kufuneka bageza izandla, kufuneka bagqoka ifonyo ngaphandle umuntu uma edla noma ephuza, kodwa isifonyo siyafuneka. Lapho abantu ke beyojima khona sekuyavulwa nakhona, kodwa kufuneka abantu abawu-50. Uma kuyijima enkulu ekwazi ukuthatha abantu abawu-50 beqaqene ngesikhathi. Siyazi ukuthi akekho umuntu ohlala ejimini ilanga lonke. Kusho ukuthi ngesikhathi kufuneka baba 50. Sekungayiwa kolwandle, kuyongcebeleka olwandle, kodwa nakhona kufanele ukuthi imithetho yezempilo igcinwe. Nemidlalo le yamanzi ehamba namanzi, kuhamba ngemkhumbi, lokho kuthiwa i-speedboat, nokobheka ama-whales, nokudiva, noshaka, yonke leyo isiyavulwa. Kodwa-ke umphathiso oqondene nayo uzosho ukuthi izosebenza kanjani. Nalapho kubukwa khona ilwane emazoo, nala kubukwa khona ilwane zasemanzini, lonke lokho sekuyavulwa. Kodwa imithetho yezempilo kufuneka igcinwe. Umphathiswa oqondene nayo uzochaza kabanzi ukuthi kuzosebenza kanjani. Indawo zokungcebeleka nokujabula seziyavulwa. Abantu nalabo abaphelezela abantu abamathoza abafuna ukubuka nokhasino sekuyavulwa. Kodwa lapho kufuneka ukuthi abantu babe 50. Kodwa kumakhasino nakwezinye indawo kuba u50%, kusho ukuthi uma ngomthetho le ndawo ithatha abantu abawu10 kusho uzofanele babe bahlanu. Mayithatha abawu20 kufanele kube wafu, kungadluli lapho. Umphathiswa wako oqondene nayo uzochaza, kodwa imithetho yezempilo kufanele isebenzile kuko konke. Masiya ematheater siyobukela abadlali noma siya kobukela ama-movie bawu50 kuphela abantu lapho abadluli ku50. Uma kuyindawo encane babe ngaphansi. Makuyindawo ekahle kwazi ukuthatha u50 kanti nohafu then thatha u50. Sesivumelekile futhi ukuvakasha, sivakashela ihlobo, sivakashela abangani. Kodwa kubaluleke kakhulu ke ukuthi mawuvakashela ihlobo, ngoba ikakhulu uzothola ukuthi igenge encane ivakashela abazali, igenge encane ivakashela omkhulu nogogo, ivakashela obabekazi, ivakashela omalume, bona abadala. Kokunye futhi banezinye izifo. Siyacela ke kakhulu ukuthi manivakasha faka imask noma usufikile ekhaya la uvakashela khona, uyigqoke ungayikhiphi. Futhi uzigeza izandla, sanitize. Futhi ningahlali nicinane. Kubalekile lokho ngoba angithi akekho umuntu ofuna ukuthi ukuvakasha kwakhe kugcine sekuletha isifo ekhaya noma sigcine sekuletha ukukhala ekhaya. Akekho umuntu othanda lokho. Ngani? Ngoba kukhona abantu abanaso lesifo kodwa bangazi, esingabagulisi, abazi ukuthi banaso. Bona bazihambela bacabanga ukuthi ba right kanti bayasifafaza. Yiko ke kufanele ukuthi mawuvakashela noma ikuphi la uvakashela khona, uzitshela ukuthi angazi noma nginaso noma nginaso. Ngakho ke angifaki imask, sifonyo asingaphumi emlonyeni. Geza izandla, sanitize, niqaqane, nixoxeke kube kuhle. Ngoba uma ngenzeki lokho uyofika wena ungazi ukuthi unesifo usithelele abantu basekhaya. Kuba buhlungu kangakanani mase begula mhlambe sebehamba emhlabeni kanti kuba wawufaka imask wahlala kude ngaba kwenzekanga. Siyacela. Sicela nje kakhulu. Njengoba kuvulwa nje zomnotho, akusho ukuthi lesifo sona sesinaso sesiyadamba. Njengoba kuvula umnotho naso sisekhona. So kufanele ukuthi na kanjani sizibheke. Asingakhathali sesisebenzile saze safika la. Asisale sesiqinisela. Senze njengaba laba basuke begijima imarathon. Hayi ukuthi basuke befika lapha be fresh. Nakhona bafika sebekhathele kodwa bayaqinisela. Athi umuntu hayi angiqinisele ngize ngiyofika. Noma eseza ukuthi uyakhathala azame. Noma eseza ukuthi sekulonely la manje abaningi abasekho sesimbalwa, uyaqinisela. Asiqiniseleni ke nathi ngoba inzuzo masifika khona yokuthi abantu abaningi impilo zabo ziyophepha, abantu abaningi ngeke basithola isifo, umnotho wethu uyoqhubeka. So inzuzo ngokuqinisela izobaningi, asiqiniseleni. Siyazi ukuthi akulula kodwa asiqiniseleni. Isifonyo nje usasusifaka nje usasuyitshela ukuthi mangiqeda ukugqoka nje before ngiphuma ngifaka isifonyo. Sesiyingxenye nje yento engiyigqokile. Ungabe usacabanga kakhulu, uyitshele nje sesiyingxenye yento engiyigqokile. Sasiwabona ama-China singazi kose kufike nala kuthina. ehlale egqoka ifonyo ungene ebhanoyini nali China nesifonyo ubheka ukuthi kwenze njani sesifikile-ke nathi lapho sekunjalo nje. Sicela-ke bakithi ukuthi njengoba kuzovula utshwala ake siphuze utshwala ngendlela. Ake singaphuzi utshwala ukuthi uphuzele ukuthi uyozu udaka ungazazi igama lakho. Ake siphuze nje kahle. Singalwi ngoba ilokulwa okwenza kugcwala ibhedlela. Ke sibe nokuthula nje noma siphuzile. Muhle kabi umuntu othi mephuzile meseze ukuthi ayi avela ayilalele. Akufuneki nje ukuthi uye ethaveni uzudaka uzungazazi ngoba usuyalwa nje awusazi nokuthi wenzeni. Kusasa usuzibona ususe stoksini. Hawu ngibulela umuntu mina. Sumbulela umuntu. Noma umuntu usesibhedlela. Noma usushaya unkosikazi, noma usushaya intombazane, usushaya ingane. Siyacela ngokukhulu ukuzithoba ukuthi njengoba buvula utshwala ake siphuze ngendlela. Futhi mawuzoshayela imoto noma ibhasi noma yini uzothwala abantu noma uzoba semgaqweni onabantu. Musuphuza uzudakwe ngoba mawuphuza angazi kuthiwa yini ama-reflex ngesizulu. Mawuphuzile ama-reflex akho aba slow. Awukwazi ukushesha. So noma uyibone enye imoto iza ama-reflex akho awekho sharp. So ugcina usushayisa. Noma umbone umuntu ecrossa noma ingane icrossa ngoba ama-reflex akho awekho sharp ugcina usuyishaya. Kanti if ubungaphuzile ama-reflex akho bezoba sharp ustope umuntu adlule. Siyacela ke bakithi. Manazi ukuthi niyophuza nabangani. Oyedwa wena akangaphuzi kakhulu. Enzela ukuthi ashayele nifike kahle ekhaya ningashayisanga umuntu nani ningalimalanga. Siyacela nje kakhulu. Bese ke sithi nje asiqhubekeni bakithi. Nasemsebenzini osomabhizinisi siyabacela ukuthi bayilandele imithetho yezempilo. Bakwenze konke okufanele. Ngoba uma bengakwenzi kuzoba nenkinga. Asifuni ukuthi njengoba kushiwo kuthiwa mhlambe kuzoba khona i-second surge, kuzoba khona isikhathi futhi la sokuphindela isifo size ngesivinini. Sizama ukugwema lokho ukuthi kungenzeki. Kodwa uma sibambisene sonke senze okufanele kuzogwemeka. Uma singabambisene kukhona abathi hayi mina angifaki isifonyo mina angenzi lutho akuzulunga. Indawo ke ezingake zivulwa indawo lezi okuthiwa ama-club asebusuku ama-night club awake zuvulwa ke wona. Sibonile kwamanye amazwe la isifo bese singathi impela sesiyaphela. Bavula ama-night club sabhebhetheka. Ngani ngoba abantu especially abasebancane bayahamba bagcwala e-night club. Basondelane, bathelelane. Bese beyapi? Bese beye emakhaya. Emakhaya khona ugogo, khona umkhulu, khona uma, khona ubaba, khona umalume, khona umalumekazi. Sebefika sebeyabathelela. Bona mhlamba asizubahlupha nokubahlupha. Abezuzazi nokuthi banaso. Bese kuyafiwa bona nasi isifo sesiqala futhi sesibulala abantu. So ke sithe asifunde indlela kuthiwa ibuzwa kwabaphambili. Siyabona kwabaphambili ukuthi ama-night club noko aseyinkinga. So sitheka ama-night club uhulumeni uthi ama-night club awakame kancane. Asigeze uvula futhi amabhanoyi okuhambisa abantu ukuthutha nje kusayilawa athutha impahla. Kodwa lawa athutha abantu nje ngaphandle makuwukuthi abantu abasuka la babuyele emazweni abo noma abantu abasuka kwamanye amazwe ababuyele ekhaya eSouth Africa. Kodwa nje amabhanoyi aya ngaphandle asavaliwe, kuvulwe lawa ngaphakathi. Nemkhumbi leyo kungcebeleka emkhulu okuthiwa ama-cruise nayo isavaliwe. Ama-crew kuphela, crew exchange avunyelwe, kodwa nje ukuthi sohamba nje organizane nje sithi sinqwaba siya kwi-cruise, cha, akavunyelwa lokho. Nezemidlalo-ke noma zivuliwe kodwa ababukeli basacelwa ukuthi babukele ku-TV. Abakezukwazi ukuya e-stadium bayobukela khona ngoba lokho bayingozi enkulu ukuthi lesifo sibhebhetheke kakhulu njengomlilo wasebusika. Lezo ke izinto ezingake zivulwa ezisavaliwe. Bese ke sithi nje sibonge kunina nonke ngako konke enikwenzile. Qhubekani, siyanicela ukuthi qhubekani noma namakhosi omdabu noma nama-NGO noma nabasebenzi amakhosikazi intsha inhlangano noma yiphi. Asiqhubekeni nje sithi ivangeli lokuthi akuqhutshwe, kugezwe izandla, kugqokwa ama-mask, kungabi nabantu abaningi. Noma imicimbi ivunyelwe kodwa awukho umcimbi ovunyelwe ukuthi ube ngaphezulu kwa50. Noma uyashada noma wenzani, isibalo sabantu asidluli 50. Umncwabo awudluli 50. Konke okwenzekayo kusadingeka ukuthi abantu baba 50 kuphela ngoba senzele ukuthi lesifo singabhebhetheki. Kothi ke mase siphela sesibona ukuthi hayi ke manje bese ke kuyavulwa, kodwa kwamanje sisacela nje ukuthi sibekezelelane, sisebenzisane, sihlangane, silwe nalegciwane. Asiqhubekeni ke silwe nalo, sifake isifonyo, sigeze izandla, siqaqane kuze kufike isikhathi lapho sokwazi ukubuyela emuva. Okwamanje sisacela ukuthi ake siqhubeke kanjalo. Siyabonga ke kinina nonke enilalele neningalalele ngako konke enikwenzayo ukuthi siphephe sisonke. Ngiyabonga.
We thank you very much, Minister, for taking us through that process that brought us to this point where we can clearly say that we have made progress in the management of this pandemic, and we welcome the progress that we have made and some of the changes that are coming out in the regulations, and also cautioning us though that we are still not out of the woods yet. We must exercise caution as we go forward. As I mentioned earlier on, the relevant ministers will give us briefings on the specifics and the details of these regulations. I'm told at 4 o'clock, Minister of Sports, Arts and Culture will be briefing us, and the Minister of Tourism will be briefing us tomorrow. And as I said, other ministers will be briefing us throughout the week. So Minister will take questions now, and I want to say that as we formulate those questions, must remember that the details part will be answered by the ministers. We must formulate questions that deal with the overall regulations at level 2. We will take questions from the callers, And then we also have questions that are coming out of the social networks. And Nongaba will be helping us with those. Do we have questions from the callers? Do we have any calls? Minister, they say you were very clear. There are no questions from the calls. Yeah. From the socials, do we have questions?
Yes, we do, Lungi.
Yes.
Okay. The first question is from Brian Sokoto from The Citizen. He's asking, much has been said by the President on how alcohol sales are to be regulated, but nothing is said about tobacco. Can we please get clarity on how the sale of tobacco will be regulated? A related question to that is from Alex Mitchley from News 24. And he's saying that the ban on the sale of tobacco products and liquor was meant to serve the same purpose, which is to limit the strain on the health system. Why is it then that liquor will be sold subject to strict conditions, but there are no restrictions on the sale of tobacco? Another tobacco-related question is also from Brian from The Citizen, is asking how is government going to mitigate against the health risk associated with tobacco? Another related question also on tobacco is from Earl September from the Sont Courant. With the sale of tobacco being permitted again, is the minister concerned about an immediate surge in respiratory illnesses, and is there any scientific evidence to this effect? Vikas from Nedvat Firendondag is asking, what is the purpose of the 10 p.m. curfew? Does the minister think this will really make an impact in the prevention of transmission compared to, for example, a midnight curfew? Another question related to the curfew is that if the curfew is 10 o'clock and establishments close at 10, what will then happen to the workers who would have been working at those particular establishments? Can I continue? Should I stop there for now?
Nongaba, I think the tobacco questions, we can take them as one question, and then we'll take two more questions.
Okay. Another tobacco question. Does the minister foresee the possibility of selling of alcohol and cigarettes being banned again if there is a second wave or a sudden spike in COVID-19 infections? And the last one is from Natasha Piri from SABC News. She's asking, won't government face a mammoth task in ensuring that social gatherings at people's private residences are restricted to 10 people? So basically asking how government is going to ensure that only 10 people would gather at a person's private residence. Thank you, Lungi.
Thank you very much.
Mlo?
Yes.
Sorry, we have one caller on the line. We have Chris from International News Network.
Okay. We'll start with answering with his question. Okay, you can bring it on.
Minister, this is Chris van Vieren from International News Network. I hear that the whole restriction on lockdown 2 is all entertainment and drinking and smoking and whatever. Is there anything in it for business, like conferences? You know, you work on percentages for theatres and shows and that. Can we limit then or take it as logical that conferences can run at 50%, the same as other people? And my second question is, how long do you anticipate this lockdown 2 to last before the entertainment industry can start again?
Thank you very much for that question. I will allow the minister to answer. Yes. We will allow the minister to respond to the questions that, as I said, that she will respond to the questions that are related to the regulations in general, and the ministers responsible will respond to the detail. Minister, you can take it from there.
Can I take it from here or should I?
Yes, you can.
Okay. Hey. Thank you very much. Maybe let me start with tobacco. And tobacco will just be sold. There are no particular restrictions on it, unlike alcohol. Part of the reason is that the reason tobacco was banned was that if you are a smoker for quite some time and you go into and you get COVID as it is a respiratory, though it affects other diseases, but other organs, but it does go into the lungs and the respiratory tract. There was evidence that was coming from other countries that the smokers would tend to have a more serious disease, which would means it will need more ICU beds and maybe need ventilators. That's one set of issues. But on the other hand, when you stop smoking, the results of stopping smoking do show pretty quickly. So your respiratory tract does improve quickly, and just your general well-being does improve. So that's why it was prohibited temporarily. But now that there are beds in hospital, there are ICU beds, there are also ventilators that are adequate should more people need them. That's why it had to be then allowed, and there are no restrictions. Of course, alcohol comes at a different level angle, because with alcohol, people drink, they drive, they fight, and we've seen literally how during lockdown, car accidents, trauma patients, trauma units were emptying when alcohol was not allowed. And we also saw when it was allowed how it went up. So to then just open completely stands a risk of the surge coming back and overwhelming the health service. That's why it was agreed that we start slowly with Monday to Thursday, 9 to 5, and also after the curfew, nobody sells alcohol. Let me also just explain this thing of the curfew. If you recall, when we brought back the curfew, it was from 9 p.m. to 4 a.m. It was the restaurants that said that their workers and other people are not able to get home on time if it's 9. It was to accommodate them to bring it to 10. But the rest, the Minister of Tourism can explain. But I just want to remind ourselves that it moved from 9 to 10 to accommodate the restaurants. And I think it's important to still keep the curfew, especially because we're opening alcohol, to see how things go. Of course, when all is well, the curfew is also a temporary measure. It's not something that's going to be there forever. But as we open alcohol, I think the curfew is useful. In terms of the police, whether they'll be able to police people who are visiting, whether only 10 people visit or more. You know, I think it's important to assume that the vast majority of South Africans are law-abiding citizens. They don't need to be policed for every action. That's the assumption that we make, that the majority of South Africans are law-abiding. When they know that this is the law, this is not allowed, they will not do it. But in addition to that, it's for their safety and the safety of their families. So it's very important that people keep to the rules, not for the sake of government, but for our own sake, for the sake of the families, for the sake of the communities, so that we limit the spread. And we limit the spread especially to older people. So that is the rationale. The rationale is not that there'll be a policeman in every household. It's not possible and it's not desirable. What is desirable is that citizens must take responsibility as good citizens and law-abiding citizens. Njengoba ngisho ugwayi njengoba uzothengiswa nje awuzuba nemigomo ethize ukuthi awuzuthengiswa nini kanjani, uzothengiswa nje njengoba kade uvela uthengiswa. Utshwala bona busenayo njengoba ngichazile. Ngoba utshwala bunezinto eziningi ezenzeka ngaleso sikhathi. Abantu mase bedakiwe bayalwa, abanye bayangena emotweni benza ama-accidents, konke lokho kugcwalisa izibhedlela ngoba abantu mase belimele baya esibhedlela, noma balinyazwe imoto, noma balinyazwe ukulwa bagcina esibhedlela, noma bayiwele sebedakiwe bengasakwazi ukuhamba bagcina esibhedlela, noma bashayiswe imoto sebehamba betiyazela emgaqweni bagcina esibhedlela. So utshwala kufanele sibuvule kancane kancane sibone ukuthi izibhedlela azuvaleka ngokusheshsha uma buvulwa kakhulu. Siyazi futhi ukuthi buthengwa kakhulu ngempela sonto, udliwa kakhulu futhi ngempela sonto. Ikhefu ake ngichaze ukuthi ngesikhathi simemezela ama-regulations adlule, sathi ikhefu iqala ngo-9 ebusuku iphele ngo-4. Abantu bama-restaurant, osomabhizinisi abarana ama-restaurant bathi iy'nkinga mayiphela ngo-9 ngoba kusho ukuthi kufanele baqede abantu abadlayo basheshe baqede, nabantu abasebenzayo isikhathi sokuklina izitsha nani bacela ithi ukuqhutshwa. Ingakho-ke veli kade isiphela ngo-10, sayiqhuba-ke ngoba uhulumeni olalelayo sayenza u-10. Yayicelwe ibona ukuthi iqhutshwe, kwakuhlangatshezwa bona ukuthi ize iye eshumini isuke ku-9. Ukhona kobuza ukuthi ngabe uma ngabe lesifo sibhebhetheka kophinde kubhenwe yini utshwala nogwayi. Hayi, ngoba ngisonisa ngoma ngizothi kubonakala ngaleso sikhathi. So bona mase sifike lapho, we are not there, we are here now. Let's not now talk about bridges that we haven't even reached. We can't cross a bridge when you are not there. We'll cross that bridge when we come to it. I-accommodation nama-conference kuvuliwe njengoba mhlambe masibheka igazethi ngishilo kuvuliwe kodwa akuvuliwe ama-conference ama-international kusavulwe lawa asekhaya. Conferences are open, accommodation is open, but internally we are not dealing with international conferences yet. I don't know whether that answers the question. It's not only entertainment, but accommodation and conferences are also allowed. Conferences and meetings which are subject to a limitation of 50 people, excluding those who are participating on electronical platforms, are open. I think I've answered the questions that were directed. I don't know if there's anyone that I missed. I could be reminded.
I think you covered all, Minister, and Minister of Tourism can further elaborate. There was a question on whether 50% or 50 people. I think Minister of Tourism will be able to deal with that.
There are instances where it's 50 people. There are instances where it's 50%. If you look at the Gazette, it's very clear. Some areas it's 50 people, and few areas it's 50%.
Okay, thank you very much. We will go back to the lines and check if there are any more questions. We'll take one more round of questions. Anything from the callers?
No, thanks, Mulungis. There's no questions at the moment on the lines. Thanks.
Thank you very much. Nangaba?
Thank you, Lungi. Christian Duplessis from Netwerk Verendondag is asking, why has government decided not to follow the differentiated strategy whereby provinces and districts are allowed to be on different levels? Helen from Caxton Local Media is asking, I note that the gazetted regulations specifically exclude nightclubs from establishments that may open. What criteria differentiates a pub, a bar, a tavern from a nightclub? She's also asking, what about chisanyamas? Are those classified as bars or nightclubs, as some people use them as nightclubs? A related question to that is from...
Okay, go ahead.
Okay. A related question is from Karima Brown, who's asking, given the experience of other countries which experienced a second waves of infections and have now restricted access to bars, is government considering learning from this, or is this a wholesale opening of bars around the country? Artwell Dlamini from Alliance News is asking, what does government intend on doing if COVID-19 cases spike again in the next couple of weeks? Might this prompt that we go back to level 3 or level 4 or level 5? Mervyn Charles from Cape August is asking, Minister, you've been criticized for the tobacco ban and the sale of on-site alcohol consumption. You've also been a subject of a number of court cases. How do you respond to the litigations and the criticism in this regard? Can I continue? Go ahead.
That is 5 questions. Can we take one more?
Okay, one more.
Yeah.
Sbungala from Newsroom Africa is asking, under which category do we place traditional ceremonies such as ukuhlabela amadlozi? Are they regarded as a social event at a place of residence, which is 10 people, or are they regarded as a religious gathering, which is 50 people? Put differently, can communities and people conduct their traditional and spiritual ceremonies under level 2? Thank you, Lungi.
Thank you very much.
Lungi?
Yes.
We have
Yes,
one
Sagalan.
caller. Yes, we have
Yes.
Nariam from Finwick. Thanks.
Okay.
Nariam, over to you.
Thank you very much. My question is about recreational sports. Will groups of people be allowed to play games like soccer, volleyball, and water polo together?
That's a question. Thank you.
Yes.
Oh, thank you very much for that. So what we will do now is we'll ask the minister to respond to the question, and then we will adjourn.
Okay, thanks very much. The Minister of Sport is already waiting outside here. He's already in this building. So I think just wait for him to explain all the sporting issues. Because if I start explaining, what will you ask him? He's here already. So please bear with me as the Minister of Sports. Spiritual ceremonies. As far as I know, if those gatherings are going to be kept at 50 with all the protocols, they will be allowed. Social distancing, masks, and washing of hands, but kept to 50 as a ceremony. 10 is visits, visitors, that I cannot receive more than 10 visitors in my house this afternoon if I wanted to receive visitors. Well, today I can't anyway until midnight, but after midnight, even after midnight, I can only receive up to 10, not more than 10. But if it's a function, a social event, it cannot be more than 50 people. Then different levels. Well, if you look at the criteria that was used to determine the hotspots, pretty much every part of our country is a hotspot still. So there was no point in differentiating them because we are trying to balance these livelihoods and saving lives. But also the way South Africa is integrated, somebody works in one district and stays in another district, somebody does their shopping in another district but they live in another district. We are very much integrated, and it's going to be difficult for now to separate. It's better to have, but who knows in future. For now, it was deemed not to be useful to differentiate. The difference between Shisanyama, between nightclub, between bar, between the ministers who deal with those things will give you definitions of those. I cannot. I do not know. The definition of a bar as opposed to a Shisanyama, as opposed to a nightclub, let me not venture into that. The ministers who deal with those, tourism, small business, they will all be briefing you sometime, and they will go to details with those things. As our facilitator did say, that I will just be talking about broad things, not going into details about, because there are ministers who are responsible, who will deal with it. Are we learning from other countries? Yes, we are. It was precisely for that reason that nightclubs are still closed. Sporting events, spectators are still not allowed. But obviously, if things go wrong in what we have opened, we will have to reconsider whatever the case may be at that time. Now, I don't know about this thing of how I take criticism. I can deal with court cases. Court cases, what we do when we defend ourselves, we tell the courts the rationale for having taken that decision, the evidence on which we based that decision, and the why we took that decision. What do we want to achieve? Will what we do achieve the purpose for which it is meant? That's really, in a nutshell. Of course, we go into details, but in a nutshell, that's how we've been defending ourselves. And that's why we've won the cases, because we've taken very rational decisions, and we've used methods that will achieve what is there, and we have used evidence that is available. Criticism about tobacco, let me just say, people I think are giving me too much credit that I do not deserve. I do not run the government. I'm part of a collective in government, but I do not run the government. Because the way people have been putting it, it's as though the entire cabinet, I tell them, we are going to limit the sale of tobacco, now we're going to open the sale of tobacco, now we're going to limit alcohol. No, I don't do that. I think you're just giving me too much credit that I do not deserve, and I think you're also shortchanging the government and the president, because the president leads a team, and it's the team that decides. Yes, everybody puts their views, everybody argues, but at the end of the day, what is decided by the team. So picking on me as though I'm the only one who decides, yes, in the end, I'm the one who signs on these regulations, because somebody has. We can't all have 30 odd signatures. Someone must take the responsibility, and I do. That's why I sign. But to pretend that it's just my decisions, I think it's actually disingenuous to say that. But if I suppose some people find it easier to find a scapegoat. That's part of life. Thanks.
Thank you, Minister. And on that note...
Oh, maybe I should also explain in Zulu.
Oh, yeah.
Indaba yokuthi yini singenzanga ukuthi kuba kuvalwe izinto ngokuhlukana, kwenye i-district kuvalwe ngokuhlukana, kwenye kokuqala nje indlela esiphila ngayo eSouth Africa ayikuvumeli lokho, ngoba khona abantu abahlala eTshwane kodwa basebenza eGoli. Manje mawuzoba nomthetho ohlukile eTshwane nomthetho ohlukile eGoli, lo muntu uzokwenza njani? Kukhona abantu abahlala esabelweni basebenze edolobheni. Mangabe kunomunye umthetho kule dolobha abasebenza kulona, kunomunye umthetho kulesabelo abalala khona, abahlala khona, kuzokwenzekani? Yiko ke sibona ukuthi okwamanje akwenzeka into efanayo yonke indawo. Yiko singazange uhulumeni ahlukanise. Indaba zokuthi sihlukanisa kanjani oshisanyama nendawo zasebusuku namabhara namathaveni, lokho kuzochazwa kahle abaphathiswa abaqondene naleyo mnyango. Indaba yokuthi sizokwazi ukudlala i-recreational sport, ukudlala singadlaleli imali nje sijabulisa. Ngingawuphendula lo mbuzo, kodwa ngicela ungawuphenduli ngoba umphathiswa ophethe lo mnyango usekhona, ngifike sekhona vele. Wathi mangiphuma uyalandela. So ngicela ukuthi lo mbuzo uthi ukuma uzowuphendula yena. Kwase kube khona obuza ngemicimbi yokwenza imisebenzi emakhaya, ukuthi le misebenzi ihlangene nalezi vakashe ezu10 noma ihlukile kodwa nayo idinga ukuthi ufake isifonyo, idinga ukuthi kugezwe izandla kahle, idinga ukuthi kuhlalwe kuqaqanwe, social distancing, idinga futhi ukuthi abantu bangabi ngaphezulu kwama50. Sebehlangene nalaba bala ekhaya bangabi ngaphezulu kwama50. Ngoba kugwemeka ukuthi ungenza umsebenzi emva kwamasonto amabili nanku sekuyangcwatshwa lapha, ngoba nifike nenza umsebenzi nangayilandela imigomo, abantu bathola isifo sebeyashona, akuzuba mnandi. Nabo laba baphansi kade nibenzela akuzuba mnandi mase kuthiwa bebela manje abantu bebezela ekhaya sebefika so kuhle ukuthi siyenze kodwa siyenze ngemthetho evumelekile yezempilo. Ukuthi siyabonela yini kwamanye amazwe njengoba amanye amazwe akade ngathi asephumlile kuleli gciwane sephinda aqala phansi. Ngizothi yebo siyabonela. Yiwo nje sithe ama night club awangaqala vula. Nemidlalo ukuthi ababukeli bangaqali babe khona. Kodwa ke futhi njengoba sivulile uma kubonakala ukuthi kunenkinga, so masifika lapho la sithola khona inkinga siphinde sicabange kabusha, siphinde senze lokho okufanele sikwenze ukuze sibhekane naleyo nkinga. Akusho ukuthi okwenzeke namhlanje cast in stone, sekuyitshe simende sewomile, cha. Sithemba ukuthi abantu bakithi bazowulalela umthetho, benze okufanele, singafiki lapho la kufanele size siphinde sibuke kabusha ukuthi ngempela lokuvala kusaqhubeka noma kusaqhubeki. Sithemba ukuthi abantu bakithi bazolalela, kodwa makhono okwenzekayo okudinga ukuthi siphinde sithathe elinye ixanti solithatha. Kwase kuba khona lo obuza ukuthi ngendaba kaGwayi notshwala ezinkantolo senze njani, njengoba kade ngixekwa mina siqu ngendaba yoGwayi notshwala ngithatha kanjani. Eyaseyinkantolo, inkantolo siyayichazela ukuthi yini eyenze sithathe lesinqumo. Besifuna ukuthi kube nomphumelo njani masithatha lesinqumo. Sisebenzise luphu ulwazi olusitshelayo ukuthi uma senza kanje kungahle kwenzeke kanje. Bese ke siyaliqoqa, siyabanikeza ke konke sibachazele kahle. Mabebona ukuthi cha sisithathe ngokomthetho lento esiyenzile futhi izokwenza ukuthi lempumelelo esifunayo ingenzeka masenza kanje. Ibheka lokho inkantolo, ibheke nobufakazi sibusebenzisile. Bese ke iyanquma ke. Mayelana ke nokugxeka mina siqu. Ngithi mina yazi ninginika amandla engingenawo. Ninginika amandla engingenawo ngempela. Ngwathatha phi nje amandla engivele ngitshela uhulumeni ukuthi vala lokhu, vula lokhu, vala lokhu, vula lokhu. Anginawo lawo mandla. Akumina ophethe uhulumeni. Uhulumeni uphethe umongameli nethimba lakhe labaphathiswa. Awuphethwe yimina. Ngakho ke ngithi nje yawu ninginika amandla impela amakhulu kakhulu engingenawo. Futhi uma ngabe sesithatha kuyaxoxwa, uhulumeni wethu kuyaxoxwa. Yilo uyafika afaka umbono wakhe, lo afika afaka umbono wakhe, aveze ulwazi ukuthi kunje kuxoxwe nje kuthathwe nembono ephuma kwabanye mhlambe njengabo ochwephesha laba abaluleka uminister wezempilo konke sixoxe sifike la sivumelana khona ukuthi nanku bese kwenzeka lokho ke hayi ukuthi khona oyedwa nje ovele nje yena be ungqo shishilizi nje enze njengoba ethanda so ngithi ninginikeza amandla engenawo akumina uthatha lezo zinqumo ngedwa yimina osayinayo ngoba umthetho usho njalo kodwa hayi ukuthi leso sinqumo sisuke sithathwe yimina ngedwa futhi nibukela phansi uhulumeni wethu manithi khona umuntu oyedwa nje ongavela lokho ethatha inqumo nje yedwa kuhulumeni ukubukela phansi uhulumeni wethu lokho ngicela nikiyeke sisebenza njengohulumeni oyicollective asisebenzi ngomuntu oyedwa ngingasho njalo kodwa ke phela mayizimo zilikhuni nje emhlabeni siyazi empilweni kuba lula nje ukuthola umuntu okuzovela kuthiwe uyena mhlambe kwenza sifile kangcono masithola umuntu oyedwa ngazi kodwa nje ayikho yonke leyo nto so mina ngithathi kabi ngithatha nje ukuthi well sesimene esinzima abantu mhlambe bathola kulula nje ukuthi kube khona umuntu abazolo bemshaya ukuthi mhlambe bazofila kangcono makunjalo kodwa nje iqiniso ukuthi sisebenza sohulumeni sikholo upresident umnumzane uCyril Matamela Ramaphosa naye akafika sho athi nje insani lokhu kuyaxoxwa kahle athatha imbono ayizwa iqale enze konke bese kuthathwa isinqumo ngiyabonga
Siyabonga Minister, and that brings us to the conclusion of this briefing. We would like to thank you for lending us your ear and for your attention. We'll see you next time. Thank you very much. I just got a text from Nkosi.
Uthini?
This evening, but I was covered.
Okay. Okay.